Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. Today, I am joined by Dr. Melina Roberts. Dr. Roberts is a fellow naturopathic doctor. She hails from Alberta, Canada, so fellow Canadian, and she focuses on a lot of really interesting areas in practice. And yeah, I'm just really excited to dive in talking about chronic illnesses, cancer, something called European biological medicine, and just a bunch of interesting topics. She has her own podcast. She's written books, and yeah, looks like a really interesting individual to talk to. We just kind of crossed paths, just happened to cross paths, and she agreed to be on the podcast, and I'm just excited to pick her brain. So I'm going to pause the recording here, and I'll be joined in just a moment by Dr. Roberts. All right, everyone. I am now joined by Dr. Melina Roberts. Dr. Roberts, thanks so much for being on the show today.
Thank you. I'm honored to be here.
Well, I'm really looking forward to our chat. And just
Yeah.
before we jump into our some of the questions I have for you, would you mind just sharing with listeners a little bit about yourself, just how you got into the areas of medicine that you got into, and just a bit of your background, if you don't mind, please.
Yeah, for sure. Like my basically origin story of how I got into naturopathic medicine was that I was a kid who had really bad allergies and eczema, and I thought it was just something I was just going to have to learn to live with. And when I was about 13, a family friend said to my parents, you should try taking her to see a naturopathic doctor. And they brought me to see a naturopathic doctor. And within a few months of following his plan and doing everything he had recommended, all of my allergies cleared up. So it was like magic. So I didn't really understand at that point in time how it worked, but that was sort of my first introduction to naturopathic medicine and some sort of idea of that the body had that ability to be able to heal itself. And so that's sort of where my introduction to naturopathic medicine and sort of why I got into naturopathic medicine. And then I guess how I get into more of my specialty is that when I was in my second year at the naturopathic college, my dad was diagnosed with pancreatic cancer. So then I started doing a whole bunch of research into natural ways to treat cancer. And I was just surprised to find that there was so much information out there, even like within the conventional medical research, like in scientific journals that were effective. Unfortunately, I wasn't able to save my dad, but it did set me on a path to just learning and doing more research into more cancer care and more like complex chronic disease. And that sort of led me on the path to trying to find more information, working with different doctors and practitioners and clinics that were having success treating cancer. And so then I went and studied with them, and that led me to a path of how I practice today, and just incorporating lots of different therapies that are effective in order to help my patients, first of all, to figure out where those imbalances are in their bodies, and then what we need to do in order to get their body into better balance. And that can be from everything from digestive issues like what I had, which was like allergies and eczema, to autoimmune problems, to cancer. So that's a little bit about me and my background. Yeah.
Probably hard to give the whole backstory in just yeah, just a few minutes. But yeah, thanks for
Yeah.
giving us a flavor of that.
Yeah.
And as you're talking, I'm just like, oh my gosh, I just want to pick your brain about oncology for like the next hour. But we'll
Okay.
probably
Yeah.
keep it a little more diverse than that, I guess. But to maybe touch on it a little bit.
Yeah.
Just before we jump into the questions, I'll just mention, as I mentioned in every episode, that nothing we're talking about should be construed as medical advice. This is all for informational purposes only. If anyone listening needs medical advice, healthcare advice, please talk to your healthcare provider to get that advice. I am just curious, though, if you don't mind sharing, like before we started recording, we were kind of comparing notes a little bit. We've had some overlapping trainings and whatnot, which
Yeah.
is always, fun when you meet a fellow nerd that likes to just do a lot of CE all the time, continuing
Yeah.
education.
Yeah.
But I'm just wondering, who are some of the kind of the biggest influences for you that you've trained with around the oncology realm, just out of curiosity?
Yeah, so probably one of the biggest ones for me was studying under Dr. Thomas Rao, doing European biological medicine. Yeah, one of the ways I got into it is that after I graduated from the Naturopathic College, I heard that there was a clinic in Toronto that was having a lot of success treating cancer. So I actually joined that practice because I wanted to see what they were doing, and what I found out was what they were practicing was something called European biological medicine. And all the stuff they were doing was like really like nothing that I had learned in school. So I was like, okay, well, how do I learn about this? How do I learn about what they're doing? The owner of that clinic was like, well, you got to go do this training, this European biological medicine training with Dr. Thomas Rao, who practices at the Paracelsus Clinic in Switzerland. And so I did that. At that point in time, they were doing this 2-year postgraduate program. And so I did that program and then did an internship at the Paracelsus Clinic. And that was probably one of the most influential aspects in terms of how I practice, even in terms of like the testing that I brought in and the therapies that I run, is using biological medicine.
Cool. So you
Yeah.
were just right up to your elbows in biological medicine over at the Paracelsus Clinic.
Yeah.
That's
Yeah, for
really
sure.
cool.
Yeah.
Yeah,
It
that's
was
awesome.
super cool. Yeah.
That's great. Do you mind if I ask which clinic were you working at in Toronto? I'm just wondering if I know them.
Yeah. So it's called Pinewood Health with Michael Rahman.
Oh, okay. Yeah,
Yeah.
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 I've never met him, but I know of him. I know he taught the mesotherapy
Yeah. Yeah.
class with me
So,
before and
yeah.
all that. And yeah, yeah. One
Yeah.
of my mentors was probably still is friends with him. And yeah, so I know the name, just never had a chance to meet him. But that's
Yeah.
really cool.
Yeah.
Um, and I mean, again, just maybe just ask one or two more oncology related questions
Yeah.
because just would like to know. But I mean, when I think about like the Dr. Rao approach, like of
Yeah.
course there's the diet and lifestyle aspect of things, which of
Yeah.
course are very very important.
Yeah.
And then in terms of some of like the shall we say like heavier hitting things that he might recommend, like this is my recollection from when I did training with him. I didn't
Yeah.
do an internship or anything like that. I did his courses when he came over here. I didn't
Yeah.
travel over there.
Yeah.
But like my recollection is he talked about IV vitamin C. I
Yeah.
think mistletoe
Yeah.
injections. I don't know if he
Yeah.
talked about IV mistletoe a whole lot, but mistletoe injections
Yeah.
is then of course Sanum remedies to help with
Yeah.
balancing
Yeah.
out patient's terrain, of
Yeah.
course.
Yeah.
Um, was that kind of the crux of it for the most part, or and of course all the dental side of
Yeah.
things as
Yeah. Yeah.
well,
That's all.
the
Yeah.
biological
Yeah.
dentistry. Would there be other like major categories? Like I don't remember him talking about like lots of nutraceuticals like curcumin and green tea and all that, but maybe I'm
Yeah.
remembering wrong. So
No,
what?
I think that, yeah, you're definitely on the right track. I think like where biological medicine kind of differs from naturopathic medicine is, well, first of all, like we all believe that the body has the ability to heal itself. And then where biological medicine differs a bit is that we really focus on terrain. So you're really focusing on cleaning up the terrain, so the area around the cells, in order to get the body to be able to heal itself. So you're trying to set up cleaning up the terrain, and then the other aspect is in terms of regulation. So in order for our bodies to be able to heal themselves, they actually have to be able to properly regulate themselves. So like all of the therapies that you're doing are addressing that, cleaning up the terrain. So how are we going to do that? Sometimes it's opening up pathways of detoxification, getting proper nutrients into the cell so that we can have proper cell to cell communication, and then the other part is making sure that the body's able to regulate. And in terms of regulation, what you want to do is you want to take stressors off of the body, and then allow the body to be able to do what it naturally does, which is be able to regulate and self-heal. So I usually talk about the stressors, which are six stressors on the body, which are food sensitivities, immune challenges, heavy metals, environmental toxins, everything emotional, and everything physical. So we're and most disease processes are multi-causal. So you have to identify and remove those stressors in order to allow the body to self-regulate. So really like, and then when it comes to therapies, like the therapies could be anything that addresses that, right? So, and the challenge, and we do use nutraceuticals for sure, but the challenge with nutraceuticals is that if the terrain isn't clean, then you can't get those nutrients into the cell. So you actually have to clean up all of that area around the cells in order to make use of those nutraceuticals because they need to get intracellular. So it's just a kind of I'm going to say a different philosophy and a different approach to typical naturopathic medicine in terms of what we learn in school. But, in terms of like the therapies that you were talked about, yes, you're using a range of those from like one of the big ones I think of as well in terms of what we're doing is drainage remedies. So drainage remedies is one that's cleaning up that area around our cells and moving toxic loads out. So those are pretty important. But then it's also like everything you need to do to clean up the gut, because the gut plays such a central role in terms of how the body heals and reacts and how our immune system functions, because about 80% of our immune system is housed in our gut. So we have to make sure that like we have to clean up the diet. We have to balance out that microbiome. We have to heal up the lining of the digestive tract and get the organs functioning better. So everything that we need to do in order to get all of those systems working better is that whole approach. So yeah, so we're using everything we need in order to get that terrain cleaned up.
Thank you for that explanation. And
Yeah.
so I'm just like, do we just turn this into an oncology episode? Because I could rain on this, but I'm not going to. I'm not going to. We'll keep it a little more diverse, I guess. But I'm just curious, what kind of drainage remedies? Like, is there a particular product line? Like, this isn't CE, CME credits or
Yeah.
anything here, so we can mention products here. But is there a particular product line that you like for drainage remedies?
So the one I use the most would be the Biomed drainage remedies. So depending on which organ systems we're working on, and or if we need to be working on the liver, the kidneys, the lymphatic system, those drainage remedies work really well. And what the drainage remedies are is they're a mixture of homeopathics and botanicals that are basically will specifically help that organ system to work better. So it increases blood flow to that organ system. And so with that increase in blood flow, you actually get that cleanup of those actual cells around it. So it's I find that those are the drainage remedies that I'll use the most. So I don't know if your audience is mainly Canadian or international or the US,
They're
but
from all over the
it's
place.
yeah, exactly. So these are probably the remedies that you can get in Canada, but in terms of worldwide, there's lots of different companies that will carry drainage remedies.
Okay.
Yeah.
And then maybe just one more oncology question here.
Yeah.
In terms of, because I'm just poking around on your very, very extensive link tree on your Instagram profile. And,
Okay.
anyways, we'll get into your book and podcast and things like that, I'm sure.
Okay.
But I saw something about, ultraviolet blood irradiation,
Okay.
ozone
Yeah. Yeah.
as well. And so do you do IV therapies in your practice? And
Yeah.
if
So
so, what are the top, sorry, and a two-part question, sorry. Do you do IV
yeah.
therapies? And
Yeah.
also, what are the top ones that you would use for folks with a cancer diagnosis as a rule?
Yeah, so we do lots of IVs in our practice in our clinic. So yeah, one of the top ones is one that you had asked me about earlier, which is the high dose vitamin C IVs. So vitamin C at that high dose becomes a pro-oxidant. So it's And at that high level, it becomes more of a therapeutic. I think sometimes people get worried that it's an antioxidant, but at that high level, it actually goes intracellular, and then it becomes hydrogen peroxide, which helps to basically kill off any sort of unhealthy cells or cancer cells. So high dose vitamin C is a huge one that we will use. And then the other therapies that we use as well, and sometimes we use them in oncology, and sometimes we'll use them if there's some sort of infectious agent that's showing up, which can happen as well, which is the UBI ozone. I typically pair those two oxidative therapies together. So UBI is ultraviolet blood irradiation. And ozone therapy is like basically oxygen with um, that extra oxygen molecule attached. So it's that three oxygens together. And what these therapies help to do is they help to oxygenate the blood. So we know that cancer doesn't like oxygen. It helps to clean up any sort of infections that might be in the blood that might be affecting how the body's functioning. So again, one of those stressors that we want to remove. And then it does have an ability to be able to also improve the immune system as well. So lots of great benefits in terms of those IV therapies. But yeah, definitely IV therapies are a big part of my practice.
Okay. And so I'm assuming a fair bit of translation or spillover, I should say, of ozone IVs into the complex chronic illness world.
Yes, yeah, for sure. Yeah, because I think that we can talk about cancer, but like really like chronic disease falls into that category as well. Like it's always just figuring out with patients, it's figuring out what those stressors are on the body and then helping the body to function better. And I think sometimes we kind of get caught up in diagnosis, right? What is that diagnosis? But really, what you learn over time is that those diagnoses are really just a combination of symptoms that have been put together, and based on those symptoms then they come up with a diagnosis, but the causative factor can be very different from patient to patient, and that's what we're really focused on. We want to look at what is the causative factor of any health issue that's coming in our door, as I'm sure you're well aware as a fellow practitioner.
I am well aware, and I think as you mentioned like sorry, I'm paraphrasing here, but kind of like the six like principles or six kind of like root cause things to look at. It's like
Yeah,
mention that with respect to cancer, but it's like, oh, it's patient comes in with mold illness. It's like, well, that applies
yeah,
to them, and chronic Lyme disease,
yeah,
fibromyalgia,
yeah,
lupus, like it applies. Those apply across the board. I'm
yeah, exactly.
constantly preaching that to my residents every time I have a new resident. It's just like,
Yeah,
we beat that into their head. It's like, yeah, just like go back to those first principles of like these are the things that we need to take into account. They don't affect everyone, of course. Like not
yeah,
everybody has, well, okay, we all have heavy metals, but not all of us have, problematically high levels. But
yeah,
we all
exactly,
have exposure to microbes, but not necessarily problematically high levels. But
exactly.
yeah, we want to have them all on the radar when we're figuring things out.
Yeah.
Um, so I guess maybe just where we're segueing a little bit more into the complex chronic illness world here. I guess I don't know. I'm not sure if this is a fair question, but I'm going to try it on you anyways,
Okay.
Melina, because you seem like a good sport.
Yeah.
I'm just wondering, like, what would you say are maybe like one or two or three of like the top things that you would prescribe that seem to lead to like clinical improvement with patients in terms of like, say, um, I'll just leave it there. Yeah, top one or two or three things that you say like, give a lot of bang for the buck for patients.
Um, so so I'm a strong believer in that we need to start with healing the digestive tract in any health issue that we have. And the reason being is that the digestive tract, like I talked about it earlier, houses about 80% of our immune system. So in order for us to take care of our immune system, we have to make sure that we take care of our gut health. Our digestive tract is also where we are absorbing the nutrients from the foods we're eating, and it's also our body's way of getting rid of toxic loads. And there's so much studies on the microbiome, which I love to see all of that new research coming out. Is that if we take care of that microbiome, that is what equating to us having a better health. So one of the things that I would say I get most of my patients on is a probiotic. So a probiotic, is that good healthy bacteria. So it's going to reestablish a good bacterial terrain within your digestive tract. And I think the challenging point is that there's lots of probiotics out there, but there's also very few of them that are really effective. So getting like a really high quality probiotic is, I think, a huge part in terms of getting people's health back in balance. So that to me is a big one in terms of making sure that we get people healthy. Um, uh, so many directions we can go in here.
Well,
I'd
actually,
say,
are you going to segue from probiotic?
yeah,
Okay, just before you do that, if you don't mind my
yeah, yeah,
interjecting,
yeah,
just like what are some parameters that you look for? Like if someone listening is like, oh, like what's a good probiotic? And talking to like, naturopathic doctor or functional medicine doctor, so someone who, knows about these things, they could give you that information, of course. But I mean, just are there some general parameters? Like, are there certain strains that you're after? Or do you need to have a certain number of strains? Not that we're giving, any dosages or anything, but are there
yeah,
any just general parameters that you could speak to? And
yeah,
sorry, multi-part question again here. And then also where nowadays, like there are the, spore form probiotics out there as
yeah,
well.
yeah.
So like, are we talking like your stereotypical like lactobacillus acidophilus, bifidobacterium type probiotic? Are we talking like a megaspore biotic type thing? So could you
Yeah,
elaborate a little bit more, please?
for sure. Yes, yeah, for sure. Probiotics itself is just a huge topic, and and I think it's also really challenging for the average consumer to figure out what probiotic is the best for them. I'm going to say, like, my biased opinion is that I'm a big fan of human microflora. So microflora that basically comes from a human. When it comes from a human, our bodies can recognize it and assimilate it really well, as opposed to finding out where those microbes actually come from, as opposed to microbes that come from like an animal source, just because those animals just have different microbes than us humans. And even though they have the same names, and even though they'll tell you that you'll get told by manufacturers that they're the same thing, I think the microbes can be different in terms of how they perform within our human microflora. So where those microbes are coming from is a big factor. Because we can also be getting them from vegetable sources or soil sources, as you'd mentioned, the spores, and those can be great for maintenance plans, but they're not necessarily great at rebuilding that foundation. Um, for sure, there's occasions where I use the spores. I like the concept of spores in terms of what the spores do. Is the spores are basically creating an environment that allows the healthy bacteria to be able to grow instead of giving the body the microbes that they need. So the concepts are just a little bit different, and for sure, I use one or the other. But in terms of probiotics, like I think we have to look at like where those microbes are coming from. So if that kind of gives you a little bit of an idea, I think I answered your question,
Yep.
I'm hoping, in
That's
terms of
perfect.
probiotics.
Yep. Thank you.
And then the other probably supplement that I use quite frequently would be something called NAG, so N-acetylglucosamine. And what that helps do is it actually helps to heal up the lining of the digestive tract. So it helps to repair the tight junctions of the lining of the digestive tract. Um, so my little mini talk on why this is important is that and I'm sure your listeners have probably heard of something called leaky gut or intestinal hyperpermeability. So it's when over time we just end up with all these little holes in the digestive tract. And when we have those holes in the digestive tract, that means that food that we're not completely digesting ends up in the bloodstream. And then when that happens, it elicits a whole immune reaction. And then we continue to do that a number of times over time. Then we have an immune system that doesn't react appropriately. And when we have an immune system that doesn't react appropriately, that leads us more susceptible to autoimmune pictures and even things like cancer. So what's really important is that we work on healing up the lining of our digestive tract. And NAG is one of those supplements that works really well at like healing up all those little holes of the digestive tract. So that's one that I definitely use a lot. Um,
That's
and
good.
then,
Interjecting question on that one.
yeah,
Okay.
yeah,
I'm
yeah,
all about the interjecting.
yeah,
So with NAG, I know that's part of a number of like combination gut health supplements, along
yeah,
with say like aloe and
yeah.
glucosamine or glutamine and
L-glutamine,
whatnot.
yeah, yeah,
Yeah, and I'm just wondering with the NAG, like, do you generally prescribe that as a because of course the trade-off is, I have a combination and there's like 10 things in the pill, but then
yeah,
there's
yeah,
maybe only 10% of a full dose in the pill. So are you using NAG as like a single supplement, or are you just getting the
yeah.
thank you helping in a combination?
Yeah, I usually use it just as a single,
Okay.
right? So then we can get some higher concentrations so that we can get more of that therapeutic benefit from it. But yeah, I know that it is, I like to also see it in those gut healing combinations with like things like L-glutamine, vitamin C, so forth, and aloe and yeah, marshmallow and stuff like that. Yeah.
All the heavy.
Um,
And sorry,
all those, yeah, all those
what
good ones for healing the gut. Yeah.
yes. And I sorry, one more follow-up question, actually, if you don't
Yeah.
mind. I just want to kind of pound for pound, like, and especially actually in the, oncology realm as well, where of course sometimes there's, you know, um, you know, chemo or radiation therapy induced, mucositis or different things like that,
Yeah.
or, intestinal issues or whatnot that might come up. And of course, glutamine in an oncology setting is maybe a little controversial sometimes,
Yeah.
depending on who you talk to. But if say there's, a patient who's dealing with, acute or chronic diarrhea or some type of
Yeah.
gastrointestinal irritation or something like that,
Yeah.
kind of pound for pound, if, say there was a patient who was going to take, we'll say like a full therapeutic dose of glucosamine on the brain for some reason, of
Yeah.
L-glutamine
Yeah.
versus say like, butyric acid versus NAG versus
Yeah.
say like a demulcent formula. And for
Yeah.
folks
Yeah.
listening, that would be like herbs like, aloe or slippery elm
Yeah.
or
Yeah.
marshmallow
Yeah.
root or whatnot.
Yeah.
Like if you were to kind of compare all those head to head, like would you say that clinically NAG stands shoulders above some of those others for like really like clinically evident signs of gut healing? Or I'm just wondering, and I'm asking selfishly for my own sake because I've never used NAG like as a single supplement, whereas I've
Okay.
used all
Yeah.
those other ones
Yeah. Yeah.
as individual ones, and I've seen good results by and large. So I'm just
Yeah. Yeah.
wondering, in your experience, like what makes NAG stand out above those others, like based on your clinical experience.
Yeah. So, and I think like everything kind of comes down to the individual and what they're presenting with,
Right.
because if they are presenting with, and I'm going to say most people are coming in with a diet is that is quite inflammatory, and you'd need to do the work to decrease that inflammation. So I find that those like all of those like botanicals are really good at just calming down that inflammation in the mucous membranes. And then the NAG is the one that will come in and heal up those tight junctions. So kind of depends on what stage, I guess, of the healing process that you're in. I typically am not doing that as like a stage one. Yeah, we first of all have to bring that inflammation down, both with the botanicals and with removing those inflammatory foods that are affecting those mucous membranes. So that's it's typically kind of where that patient is at. Um, does that
Yeah,
answer
no,
your
that's
question?
perfect.
Yeah,
Yes,
in
thank
terms
you.
of priorities.
Yeah,
Yeah, it's,
thank you.
it's yeah, usually in stages, right?
Okay.
Um, and then you're gonna make me answer a third, right?
You don't have to. I said two or three,
Yeah.
so I mean, we
Two. Oh,
can.
you said two or three. Yeah,
I
so
did.
those are the big ones.
Okay.
Um, well, I would say like another one that I use a lot in my practice is proteolytic enzymes. And so proteolytic enzymes, if you take them with foods, they help to break down the foods you're eating. If you take them between meals, they break down inflammatory factors in the body. So taking a high amount of proteolytic enzymes away from food is a huge way to help to bring down that inflammation in the body. And what we know is that most chronic diseases are due to inflammation. So we need to bring down inflammation in the body, and proteolytic enzymes work really well in terms of bringing down a lot of those inflammatory factors in the body. So that's also one that I use a lot in my practice.
And which proteolytic enzymes do you like?
So I know this was a CE course. I would have to be like, you could talk to me afterwards about that.
No,
um,
anything you want on here.
yeah, so the one I use is Intenzyme Forte by Bionics.
What are the like? Is it like nattokinase, stratopeptidase, lumbar kinase? Like, what are the?
I know I need to grab the
Okay, it's
bottle.
okay. It's okay.
But
It's
it's
okay.
it's
No
not
worries.
nattokinase. Nattokinase is kind of I use it on its own.
Mhm.
Yeah, not as the proteolytic enzymes.
Gotcha.
Yeah.
Okay,
Yeah.
great. Um, So, as far as kind of your approach with complex chronic illness, like you mentioned, more in the well, we mentioned when you were talking about biological medicine that regulation is really important, and
Yeah.
one
Yeah.
of the things that almost every one of my guests has talked about on this podcast, not maybe not all of them, but a lot of them, is
Yeah.
just how important it is for like nervous system regulation
Yeah.
specifically. I know
Yeah.
regulation is kind of a little more broad spectrum in the
Yeah. It is.
biological medicine realm, which I feel like they were talking about regulation before it was cool.
I know for sure.
They've been on that track for a lot longer than most.
Yeah. Yeah.
But in terms of nervous system regulation specifically, are there certain therapies or approaches that you found to be helpful? And just for folks listening, like this would, maybe include things like neurofeedback or
Yeah.
amygdala retraining or the safe and sound protocol or various things like that. So the primal trust is kind of a combination of a lot of different things.
Yeah.
So
Yeah.
just wondering if that plays into your mental algorithm somewhere, and if so, like what are the things that you're typically recommending for your patients?
Yeah, so yeah, one of the big components in terms of regulation is looking at something called heart rate variability. So heart rate variability is assessment of the autonomic nervous system. So that's the nervous system that's working in the background that we can't consciously control. So two parts of that nervous system, there's your stress state and then there's your rest, digest, and repair. So we want to see how stressed is a person and how well can a person repair themselves. And so, in terms of things that affect that heart rate variability, it can be a number of things, but it's everything that we want to do to help shift a person out of that high stress state to being able to easily be able to go back and forth between sympathetic, which is your stress state, and parasympathetic, which is your rest, digest, repair, right? And I think there's lots of different tactics. I think one of them that works really well is heart math. Heart math is a great way, a great kind of biofeedback way of seeing what state your heart rate variability is in real time, and then gives you some breathing tactics so that will help to shift your body into parasympathetic. I really love the apps and the heart rate variability in terms of helping to shift people. But even just getting people to do deep breathing exercises on a regular basis does help to retrain that nervous system to be able to shift their body into parasympathetic. We have things in our clinic like something called flow presso. I don't know if you've heard of that, but the flow presso is something that you lie in, and it's increasing and decreasing, inflating and deflating, sort of like a blood pressure cuff,
Mhm.
and all over the body. And what it's doing is it's helping to move the lymphatic system. But within that therapy, what we do is it's a nice rhythmic therapy to help move the lymphatic system. But we also help to shift the body into parasympathetic by putting some noise canceling headphones on them with a meditation, and then we put an eye mask on their eyes. And what that therapy helps to do is, on top of helping to move the lymphatic system, it also helps to shift the body into that parasympathetic state. And even for people to realize what parasympathetic feels like, because most people come off of that machine going, "Oh my gosh, I felt so good. That was such a nice, relaxing therapy." And I would say that most people aren't even in parasympathetic during the day. You know, the only time that they're actually getting into parasympathetic is during their sleeping hours, when your body does a bunch of its healing. So yeah, so that therapy for sure can be very beneficial. And then just trying to think of other things. I'd say deep breathing exercises are great ones that you could do at home. That flow presso is great. And then also, like, if we need to take some stressors off that nervous system, so doing some like emotional clearing in terms of, and there's lots of different tactics to do that, but clearing some stress off of that nervous system in order to help it to properly regulate and properly heal. So,
Great.
yeah.
Um, One thing that I wanted to ask you about, and I'm sorry, I just didn't have myself quite organized enough to write down the name before we started the interview, but could you remind me what's the name of the book that you wrote?
Oh, yeah. So, I wrote a book called Building a Healthy Child. Um,
Okay.
is
You've
that what
written
you're referring to?
more than one book. There was one, it had like
I
a,
do. I do
it
have,
was something
yeah.
about
So,
pain. It was like,
okay, yeah. So I wrote, the most recent thing I've done is I've written a chapter in a book called Gifts of Pain.
that's what it was. Yeah.
Yeah.
Okay.
So that's
Thank you.
probably the most
Yeah.
recent thing you've seen.
Okay.
Yeah. Yeah.
Yes.
Yeah.
And it just with that title, you know, most people don't think of pain as being a gift, and I just was wondering
Yeah.
if you wouldn't mind maybe speaking to where that. I mean, if you wrote a chapter in it, I'm assuming you did not come up with the title, but uh,
I did. Yeah.
would you mind just maybe speaking to what that book was about? And yeah, I thought it
Yeah.
was quite an intriguing title for a book. So
Yeah, and I think that like most people like you and me, the reason we do what we do is like there has been something that's happened in our lives that make us do what we do, right? So that's for me, that was like my in terms of the chapter that I wrote was like sort of my origin story of why I do what I do. So mine is about the death of my father. that my dad dying of cancer was the reason, and I go into that. It was the reason why I really focus my practice in terms of helping people with cancer and chronic disease in general. But yeah, that's my chapter, and I think that it's filled with lots of people's stories. It's really interesting because I share that with, I think it's 31 co-authors, and everyone has like an inspiring story of something, painful that happened in their lives that led to something positive, led them to doing something positive in their lives. So I think that that's really the essence of that book. It is filled with like really inspiring stories, and I just have a little chapter in there.
Okay. Great. Well, thank you for explaining that. And
Yeah.
yeah, I mean, I think we can probably all look back and say like, oh, that thing that was, painful or challenging, like there's something good that maybe came out of it, or something we
Yeah,
learned at least, or it made us a
exactly.
more resilient person or something like that. So yeah, that makes a lot of sense.
Yeah,
Um, I know we don't have a ton of time left, Dr. Roberts, but there's a couple more questions I was hoping to squeeze in.
for sure.
I'm a bit of a self-professed mitochondriac. Really big
Okay.
fan
Yeah.
of mitochondrial support.
Yeah.
I've given a lecture once, and it's called something like mitochondria, or like the root of mitochondrial dysfunction is the root of like all illness, or something like
Yeah.
that, beyond like
Yeah.
broken bones or something like that. And even then, you need the mitochondria to get the energy to repair the injury.
For sure.
But just wondering if in with biological medicine, at least when I did training in biological medicine many moons ago now, there wasn't really a lot of talk about the mitochondria. I mean, maybe it
Yeah.
was implied or indirectly touched on, but I'm just wondering if working on mitochondrial dysfunction is something that everything, you said all the train work, it's all working on supporting those mitochondria,
Yeah.
but are there direct mitochondrial supports you work with, tests for the mitochondria, anything that's more like kind of mitochondrial specific, or is it more of a indirect relationship that you have with your patient's mitochondria?
Um, yeah, I think it's actually pretty awesome that we're talking about the mitochondria because yeah, we know that that's like the powerhouse of the cell. And I think that when it comes down to it, like everything that we do, and if we want to have a benefit in terms of people's health, we need to somehow figure out a way to get nutrients into the mitochondria, and to help benefit it. So I would say that in terms of like what we do in biological medicine is that what we're doing is we are cleaning up the terrain, so the area around our cells, in order to get the proper nutrients into the cells to make sure that we're able to support those mitochondria inside of the cells, right? In order to allow that mitochondria to be able to make energy. So, so like I feel like everything we do um, is affecting the mitochondria, even though I'm not directly doing testing of the mitochondria or supplements specifically for the mitochondria, because I think that one of the biggest ways that we can actually see how well a person's functioning, or mitochondria is functioning, is just asking those simple questions like what is your energy at? Like what are you operating at in terms of our actual outputs of the energy in our body? And I would say that most people feel that the energy that their body is running at is not running at optimal capacity, right? So understanding that our bodies at a basic level are electrical beings, and mitochondria is like a measure of that electricity, and how well our bodies can actually produce electricity, that energy, is how well our body's actually going to be able to function, and that works for really every system of our body. So when I think of the body in terms of that electricity, I do have like some testing tools that will look at it from that point. Like I do something with all of my patients called electrodermal screening, and so I'm measuring the electricity of the body, and then we get an idea of how every system of the body's doing. And to me, that is an output of, even though I won't describe it that way, but to me that is an output of how the mitochondria is functioning when we have, how much energy is it producing electricity. So yeah, I guess indirectly, directly is how I look at the mitochondria. Yeah.
You can have it both ways. That's great. Um,
Yeah.
yeah, dovetailing on something you just said a second ago, like because I've, unfortunately, have not been able to find a, direct test for mitochondrial
Yeah.
output. I know
Yeah.
there's some interesting things out there, but it's, nothing I think that's been definitively developed or whatnot. So yeah, I've oftentimes said like the best test is like, well, look in the mirror and ask yourself, do I feel tired? And if the answer is yes,
Yeah.
then you've got
Yeah.
some degree of mitochondrial dysfunction. Like
Yeah.
it's
Exactly.
simple,
Yeah.
but
Yeah.
yeah. So, Dr. Roberts, just as we're kind of winding things down here, I'm just wondering if you could tell listeners like if they want to, work with you, or if you have any like online offerings. I know you have a podcast, you have more than one book, which
Yeah. Yeah.
anyways, should have done
Yeah.
more prep. I thought there was
Yeah.
just the
No, no,
one
that's
book,
okay.
so
Yeah. That's no
it's
problem.
no not
You're
enough
looking at
hours
the
in the day.
most recent things. Yeah.
There we
Yeah.
go.
For sure.
Yes.
Yeah.
But would you mind just telling folks like where they can contact you, any online offerings you have, podcast? I'll put links in the show notes, but just could you share with listeners that information?
Yeah, for sure. So, probably the best way to find out more about me and what I'm doing is my website, which is advancednaturopathic.com. The place where I'm probably the most active is Instagram, and my handle there is Dr. Melina, Melina Roberts. So Dr. Melina Roberts is my handle, and that's really, I think, my handle on um, most of my social media. I have a podcast and a YouTube station, but you can find that all through my website. I have some online courses that may be of benefit to you, about, from healing the gut to how to introduce foods to our babies so that we build up their microbiome correctly right from the beginning, to balancing the thyroid, to how to properly detoxify the body. So those are just ones that may be of interest to people. So those are just different things that I have. And yeah, I think you can find those all on my website or through the links in my Instagram. So I think that's
Awesome.
probably the best way. Yeah.
A lot of content. So
Yeah. Yes.
if you have a weekend that you don't have anything to do, go through all of that. No, that's
Yeah.
wonderful. And yeah,
Yeah.
it's wonderful that you're so proliferative with, all the information that you put out there. And yeah, and I just really appreciate you taking the time to chat with me today, Dr. Roberts. It's always nice to talk to someone who's cut from similar cloth, and
Yeah. Yeah.
yeah, it's nice to compare notes on a few things. So thank you so much for taking the time today.
Yeah, no problem. Thank you so much for having me. This has been an honor and pleasure.
Pleasure was all mine. And
Yeah.
thank you, folks, for listening to this episode of the Overcoming Chronic Illness podcast, or two podcasts. Trying to remember which one was it today? Overcoming Chronic Illness podcast. We hope that you enjoyed it, and please stay tuned for the next one.